Hello and welcome back to our Humana Insurance tutorial part 3. If you have been following along, then you have already got a good understanding of the basics and how to navigate some of the essential features of your Humana Insurance plans, guys. Now, in this third part of our series, we will be diving deeper into understanding the rules of Medicare enrollment. So guys, let's get started.
So in our first video tutorial, we have discussed about Medicare basics. In our second video tutorial, we have discussed about types of Medicare plans, different types of Medicare plans. And today, in today's video, we are going to talk about Medicare enrollment. Now, in Medicare enrollment, there are a few topics, few contents which we are going to discuss. Understanding Medicare enrollment period. That is what we are going to discuss. Medicare open enrollment guide. How do I switch Medicare plans? How do I enroll in a Medicare Part D plan? All right. So let's click on the first option, understanding Medicare enrollment periods. All right. So let's wait. Perfect. So we are on this page and Medicare enrollment periods. When can I enroll? If you are becoming eligible for Medicare or you are looking to change Medicare plans and coverage, knowing the dates and details of your enrollment period is important. Now, here is some information to help you get the Medicare coverage. You need to avoid penalties or gaps in coverage. Now, there are few contents in this which we are going to cover. Those are initial enrollment period, Medicare supplement open enrollment period, Medicare's fall open enrollment period, Medicare Advantage open enrollment period, general enrollment period, special enrollment period, guys. So let's scroll down. When can I sign up for Medicare for the first time? So here, initial enrollment period, which is also called as IEP. For many people, Medicare's initial enrollment period is your first chance to enroll in original Medicare Part A hospital insurance and Part B medical insurance. If you are under 65 and receive Social Security or Railroad Retirement Board benefits, you may be automatically enrolled in a original Medicare. However, you will still have an IEP and will be able to make Medicare coverage decision during that time. Now, dates: IEP begins 3 months before you turn 65 through your birthday month and end 3 months after. Now, during your initial enrollment period, you can enroll in original Medicare Part A and Part B, delay Medicare Part B if you are already have creditable coverage, enroll in a Medicare Advantage Part C plan. You can enroll in a Medicare Part D prescription drug plan, guys. Let's understand additional information. When you become eligible for original Medicare, you also become eligible for Medicare Advantage Part C. The first enrollment period for Medicare Advantage is called the Initial Coverage Election Period. In short form, it is called as ICEP. Now, if you don't sign up, if you don't sign up for Medicare when you are first eligible, you may face late enrollment penalties. If you are still employed when you become eligible for Medicare, you may delay enrolling in Part B and qualify for a special enrollment period later. Now, learn more about when to sign up for Medicare if you are still working past 65. So this is in blue. You can click and you can get the details. All right, so let's scroll down. Now, Medicare supplement open enrollment period. The Medicare Supplement Open Enrollment Period is your best time to buy a Medicare Supplement insurance plan without answering health questions, even if you have health problems. you can buy any policy a company sell for the same price as people with good health. Now, let's see the dates. For Medicare supplement open enrollment period begins the first day of the month you have Medicare Part B and you are age 65 or older. For many people, this is the first day of the month they turn 65. During Medicare supplement open enrollment, you can buy any Medicare supplement policy sold in your state even if you have health problems. You can potentially get a better price and more choices among policies, guys. Now, additional information: after this 6 months enrollment period ends, you may not be able to buy a Medicare supplement policy. If you are able to buy one, it may cost more due past or present health problems. If you apply after your open enrollment period, there is no guarantee that an insurance company will sell you a policy unless you are eligible for a guaranteed issue right. If you are under age 65 and have Medicare, you may not be able to buy a Medicare supplement policy or the one you want until you turn 65. Now, some states do require companies to sell you a policy even if you are under age 65, guys. Now here you can see Medicare enrollment periods calendar. So you can go on the official website. This is the website, and you can browse. Even you will get a chance to see on your screen, guys. All right, so let's scroll and understand when can I join, switch or drop a Medicare plan throughout the year. Now, Medicare open enrollment period. Medicare plans can change each year, including cost, coverage, and networks. Medicare's open enrollment period, known as the Medicare Advantage and Prescription Drug Plan, annual election period or annual enrollment period, take place each year from October 15th through December 7th. Coverage changes start on January 1st. The plan gets your request by December 7th. This is the primary time when people with Medicare can choose a plan, but there are other times during the year that may be called open enrollment or special enrollment. Special enrollment period, my bad, when a person can enroll in a plan, which are explained in more detail, okay, below. Dates October 15th to December 7th, guys. Now, during Medicare open enrollment, you can switch from original Medicare to a Medicare Advantage plan or vice versa. You can join a Medicare Part D prescription drug plan. You can switch from a Medicare Advantage plan with drug coverage to a Medicare Advantage plan without drug coverage or vice versa. You can change Medicare Part D prescription drug plans. You can disenroll from a Medicare Part D prescription drug plan, guys. Now, here are the additional information. Your coverage will begin on January 1st if the plan gets your request by December 7th. Now, Medicare Advantage enrollment period, open enrollment period, which is called as MAOEP. Okay, I will repeat it once again. Now, Medicare Advantage open enrollment period, in short form, it is called as MAOEP. If you already have a Medicare Advantage plan, the Medicare Advantage open enrollment period is when you can enroll in another Medicare Advantage plan or go back to original Medicare. However, you can only make one change within the period and other rules apply as well. Now, date is from January 1st till 31st March. Now, during the Medicare Advantage open enrollment period, you can switch to another Medicare Advantage plan with or without drug coverage. You can switch back to original Medicare and, if needed, add a Medicare Part D prescription drug plan. Here is the additional information. Changes take place the first day of the following month after the enrollment request is received. Now, general enrollment period, GEP, guys. Now, if you miss your chance to apply for original Medicare during IEP, or you weren't automatically enrolled, the Medicare General Enrollment Period is your chance to sign up for Medicare Part A and Part B. Dates is from January 1st till March 31st. Now, during this general enrollment period, you can sign up for Medicare Part A and Part B. Now, additional information is coverage will start on July 1st. You may have to pay a late enrollment penalties. Now, special enrollment period, which is also called as SEP in short form. A special enrollment period is your chance to make changes to your Medicare coverage outside of the open enrollment period when certain events happen in your life. When do you qualify for a special enrollment period? Now, certain life events may qualify you for a SEP. This can include losing your existing coverage, moving, then your Medicare plan changed, your ability to get other healthcare coverage, your eligibility changed. Now, dates, the length of your SEP can vary depending on the type of qualifying event. Generally, your SEP will last 2 to 3 months depending on the time of the qualifying event. Your SEP to sign up for Medicare Part B lasts 8 months after your employer health coverage ends. Now, let's understand during a special enrollment period. Okay, now during your special enrollment period, you can sign up for Medicare Part A and or Part B if you delay coverage due to employment. You can make changes to your Medicare coverage, including Medicare Advantage and Medicare prescription drug coverage, guys. Now, do I need to re-enroll every year? That's the question. Let's get answer to this question. If you are already enrolled in original Medicare or a Medicare Advantage plan, your plan will renew automatically. Now check out these renewal and enrollment details of common Medicare plans for more information. In blue, it's mentioned renewal and enrollment details of common Medicare plan. You can click and get the details there. Let's move ahead. Explore your Medicare coverage option. Your health and prescription drug needs can change from year to year. Now that you understand the details about Medicare enrollment period, it may be a good time to learn more about your Medicare coverage options. Here is some helpful information to compare Medicare Advantage plan and change your Medicare Part D prescription drug plans, guys. So let's scroll. All right. Superb. So I'm sure now we have understood this page, Medicare enrollment periods, and when can I enroll, and this complete page we have discussed. Let's move to a second option, Medicare Open Enrollment Guide. But before that, let's check these details. Just give me one moment. All right. So perfect. Just give me one moment, guys. So we have discussed all these options and contents. I was going through it. I was checking whether we have discussed or not. Perfect. Now let's move to another option that is another content, my bad, that is Medicare Open Enrollment Guide. So I've clicked on Medicare Open Enrollment Guide, Medicare Open Enrollment Period, what you need to know. Okay. All right. So Medicare plans can change each year, and so can your health care needs. The Medicare open enrollment period, which occurs each year from October 15th to December 7th, you can change to review and make changes to your current Medicare coverage. Okay. Uh, Okay, this gives you a chance to review and make changes to your current Medicare coverage, guys. Now, here is some information to help you prepare for Medicare open enrollment and get the most out of your Medicare coverage in 2024, guys. Let's understand the key points. If you are already enrolled in Medicare, you can make changes to your plan during open enrollment. Now, Medicare open enrollment for 2024 plans starts October 15th, 2023 and ends on December 7th, 2023. Changes you can make during 2023 open enrollment go into effect on January 1st, 2024, guys. Now, when is the Medicare open enrollment period? Now, Medicare's open enrollment period, known as the Medicare Advantage and Prescription Drug Plan, and annual election period, annual enrollment period, or AEP, takes place this year from October 15, 2023 through December 7, 2023. Medicare coverage changes go into effect on January 1st, 2024 if the plan gets your request by December 7, 2023. This is the primary time when people with Medicare can choose a plan, but there are other times during the year that may be called open enrollment or special enrollment periods when a person can enroll in a plan, which are explained in more details below. So now, what can you do during the Medicare open enrollment period? Now, people already enrolled in Medicare can make changes to their Medicare plan coverage, such as switching from original Medicare to a Medicare Advantage plan or vice versa, switching to a Medicare Advantage plan with or without prescription drug coverage, switching from one Medicare Advantage plan to another, joining, switching, or leaving a Medicare Part D prescription drug plan, and switching to a new private insurer. All right. So now, what should I consider during Medicare's open enrollment? When shopping Medicare plans during open enrollment, some coverage details to consider include out-of-pocket cost, that is premiums, deductibles, co-payments, and any other payments not covered by Medicare, prescription drug coverage, eligibility requirement, medication coverage, and costs, generic versus brand name, etc. Healthcare needs, any upcoming surgeries or doctor appointments you may have in the coming year. Travel plans, original Medicare typically does not cover services overseas. So if you plan on traveling out of country, you might consider buying a supplemental insurance plan that will cover you in case of an emergency. Now, what are the different parts of Medicare available during open enrollment? All four parts of Medicare are available during the open enrollment period. Original Medicare Part A and Part B. Original Medicare is provided by the federal government and comes in two parts, Part A and Part B. Medicare Part A is a hospital insurance. It has no premium cost if you have paid payroll taxes for at least 10 years. Medicare Part B is medical insurance. It requires you to pay premiums, co-pays, and deductibles like private insurance companies. In 2024, the Part B premium is $174.70 or higher depending on your income, guys. However, original Medicare does not cover everything. If you need prescription drugs or routine vision, dental or hearing care, you may want to consider additional coverage option. Now, Medicare Part C, Medicare Advantage, and Medicare Part D prescription drug coverage. Beyond original Medicare, there is further coverage through Part C and D. Medicare Part C, Medicare Advantage, is offered by private insurers and often combines Part A, B, and D in one plan. Now, Medicare Part D is a prescription drug coverage. It is an optional prescription drug plan offered through private companies. Let's scroll. Many Medicare Advantage plan includes coverage for prescription and may offer dental, vision, and hearing benefits. You may need to pay a monthly premium in addition to the Part B premium, but it may be worth it based on your needs. Now, important Medicare enrollment dates mark on your calendar. Now, here is the chart. Here you can see dates, and just below that you can see details. So now dates: October 15th to December 7th, Medicare open enrollment. From January 1st, Medicare changes take effect. January 1st to March 1st, Medicare Advantage open enrollment. Extra times for Medicare Advantage plan members to switch and drop their MA plan. So guys, you can just have a look on the website as well. Okay, let's scroll. What if I miss Medicare's open enrollment? If you miss open enrollment, you will most likely be automatically re-enrolled in your plan if it's still offered in your area. You will keep the same plan the following year as long as you continue paying any necessary premiums. However, there are few circumstances where you can change your plan outside of open enrollment. These circumstances include special enrollment period, SEP. Generally, you can join or switch to another plan when certain events happen in your life, such as moving or losing other insurance coverage. Medicare Advantage open enrollment period, which is called as MAOEP. If you already have a Medicare Advantage plan, you can enroll in a different Medicare Advantage plan or go back to original Medicare between January 1st and March 31st, guys. Now, 5-star special enrollment period. If a Medicare plan with a 5-star rating is available in your area, you can switch from your current Medicare plan to a Medicare plan with a 5-star quality rating. You can use this special enrollment period only once between December 8 and November 30 the following years, guys. Now, additional Medicare enrollment frequently asked questions. So let's go through these questions and see the answers to this question. So the first question is, who can apply during the Medicare open enrollment period? Let's click. Only existing Medicare members can apply for a new plan unless they qualify for special enrollment at that time. Now, second question, when can I first sign up for Medicare? Most people first become eligible for Medicare at the age 65, but your initial enrollment period, IEP, begins 3 months before the month of your 65th birthday, includes your birthday month, and continues 3 months after. Because there is a delay from the date of your enrollment to when Medicare coverage starts, try to sign up for Medicare during the 3 months period before your birthday to avoid a gap in your coverage. So that was another question and the answer. Let's go to this question. When is the Medicare Advantage open enrollment period? If you already have a Medicare Advantage plan, the Medicare Advantage open enrollment period, which is called as MAOEP, is when you can enroll in another Medicare Advantage plan or go back to original Medicare. The dates for this enrollment period are from January 1st to March 31st. If needed, you can also add a Medicare Part D prescription drug plan to your Medicare Advantage plan. Compare Medicare Part D plans to understand the difference between standalone prescription drug plans, PDP, and Medicare Advantage plan with a prescription drug plan, which is called as MAPD. Now, let's scroll down. Another question: when is open enrollment for Medicare supplement insurance plan? Your chance to enroll in a Medicare supplement plan without medical underwriting is called the Medicare Supplement Open Enrollment Period. The timing of this enrollment period is unique for everyone. It's a 6-month window that begins the first day of the month you are enrolled in Medicare Part B and age 65 or older. For many people, this is the first day of the month they turn 65 years old. Some states have additional open enrollment periods, including those for people who are under age 65. The Medicare Supplement Open Enrollment Period is the best time to enroll in a Medicare Supplement plan without answering health questions. Even if you have health problems, insurance companies cannot deny you a Medicare supplement policy and must offer the same price as people with good health. If you apply after your open enrollment period, there is no guarantee that an insurance company will sell you a policy. Unless you are eligible for guaranteed issues, right? If you are under age 65 and have Medicare, you may not be able to buy a Medicare supplement policy or the one you want until you turn 65. All right. So Humana is here to help. This is the message from Humana is here to help. Even if you are happy with your current Medicare plan, it's important to check any changes next year and compare Medicare plan options, including Medicare Advantage and Medicare Part D prescription drug plans, where we are here to help you make sense of it all so you can choose your plan with confidence. Okay, licensed Humana sales agents are just a phone call away, guys. You can schedule an appointment to talk with a licensed Humana sales agent to explore your options. Now, these are the contact number. You can also contact Medicare directly from the information by calling 800 Medicare 800 633 4227. This is the number, 24 hours a day, or by visiting the Medicare website, guys. So I'm sure that now you understand this page we have discussed. So we have discussed on this topic, Medicare's open enrollment period, what you need to know, right? So now let's understand, how do I switch Medicare plans, guys? So this is the third third option, which we are going to understand. So we are on this page right now. How to change your Medicare Advantage plan. If you already have a Medicare Advantage plan, which is called as MA plan in short form, and want to switch coverage, you have 2 enrollment periods each year to make the changes. Let's explore your options for switching Medicare Advantage plans. The key points are, you can make changes to your plan each year during Medicare's open enrollment period and the Medicare Advantage open enrollment period. The only time you can change your Medicare plan, a Medicare Advantage plan, outside of the usual enrollment periods is if you qualify for a special enrollment period, which is called as SEP, guys. So when can I change my Medicare Advantage plan? All Medicare members have 2 enrollment periods each year to make changes to their existing Medicare plan. Now, Medicare open enrollment period, and the date is October 15th to December 7th. The Medicare open enrollment period, also known as annual election period, in short form it is called as AEP, SEP, takes place each year from October 15th through December 7th. During this time, you can switch from one MA plan to another MA plan. You can change from an MA plan back to the original Medicare. You can switch from original Medicare to an MA plan. Okay, and remember this, all changes made during the open enrollment period starts from January 1st the following year, guys. Now, Medicare Advantage open enrollment period from January 1st to March 31st. The Medicare Advantage open enrollment period, which is called as MAOEP, is another chance to enroll in a new MA plan or go back to original Medicare. However, you can only make one change within this period. During this time, you can switch from a MA plan without drug coverage to an MA plan with drug coverage. You can switch from an MA plan with drug coverage to an MA plan without drug coverage. You can switch from MA plan back to original Medicare with the option to join a standalone Medicare prescription drug plan Part D. Remember, all changes made during MAOEP starts the first day of following month after the request is received, guys. So let's understand this. Can I switch my Medicare Advantage plan at any time? So the answer to your question is no. If you want to switch your MA plan outside of the usual Medicare enrollment periods, you must qualify for a special enrollment period, which is called as SEP in short form. A special enrollment period SEP, is your chance to make changes to your MA plan when certain events happen in your life. Qualifying life event can include losing your existing coverage, moving, then your Medicare plan changes, Medicare plan changing, ability to get other healthcare coverage, your eligibility changing. Okay, the length of your SEP can vary based on your qualifying life event. Generally, your SEP will last 2 to 3 months depending on when the qualifying event happens. Now, there is a note. If you enrolled in a MA plan during your initial coverage election period, which is called as IEP, when you first become eligible for Medicare, you can change to another MA plan and go back to the original Medicare within the first 3 months after you enrolled. Okay, let's scroll. Choose the best Medicare Advantage plan for you. Now, everyone has different health needs. If you are thinking about switching your MA plan, take some time to research and compare Medicare Advantage plans to find the best one for your needs. Now, here are the frequently asked questions. Let's go through the questions and see the answer. Now, here is the question. First question, can I switch from Medicare Advantage back to original Medicare? The answer to this question is yes. You can make this switch during Medicare's open enrollment period and the Medicare Advantage open enrollment period. Now, the second question is, when can I switch my Medicare Part D plan? And the answer to this question is, you can, just give me one moment. Perfect. So the answer to this question is, you can have certain times throughout the year to change your Part D plan. For more information, you can check out how to change your Medicare Part D prescription drug plan. So this is in blue, it's mentioned. You can just click there, get the details. Now let's move to another question. Question number 3, do I have to renew Medicare each year? And the answer to this question is no. If you are enrolled in original Medicare Part A, Part B or an MA plan, your plan will renew automatically. Now check out these details about renewing Medicare each year to learn more. Now here it's mentioned in blue. You can click and get more detailed information. All right. So I'm sure that we everybody are on same page. Now we know how to change your Medicare Advantage plan. So how do I switch Medicare plans? This was the topic which we discussed. Now we are going to move to another topic. How do I enroll in a Medicare Part D plan, guys? Perfect. So I have clicked on this option. We are on this page right now. How to enroll in a Medicare Part D prescription drug plan. Now, once you have Medicare Part A and B, often called as original Medicare, you are eligible for a Part D prescription drug plan. These plans can vary based on price, coverage, and the formulary. The list of covered prescription drugs, because each Medicare Part D plan may be different, it's important to compare plans before you enroll. There are two different ways you can get prescription drug coverage. You could enroll in a standalone Medicare Part D plan, or you could get drug coverage as a part of Medicare Advantage plan. Now, there are also a few different ways you can enroll. Number one, use Medicare Plan Finder tool to enroll online. You can call the plan you want to enroll in. Call 1-800-Medicare. Okay. Now, when can I sign up for Medicare Part D? Your first chance to sign up for Medicare Part D is during your Medicare Initial Enrollment Period, which is called as IEP. But there are other opportunities to enroll too. You may be able to enroll during the Medicare Advantage Open Enrollment Period, OEP, or the Annual Enrollment Period of Medicare, guys. Now, let's scroll. Initial Enrollment Period of Part D. Now, the IEP, which is called as Initial Enrollment Period of Part D, okay, for Medicare starts 3 months before the month you turn 65 and ends 3 months after. During this period, you can choose a Part D plan once you enroll in Medicare Part A and Part B. Now, open enrollment period annually for Part D. You can make changes to your Medicare coverage, including Part D prescription drug plan during the Medicare annual election period, which is called as AEP. This is sometimes called the open enrollment period or fall open enrollment. It runs from October 15th to December 7th each year during the Medicare AEP. You can add, switch, or drop your Part D coverage. Any change you make will take effect on January 1st the following years. Medicare Advantage Open Enrollment Period annually. The Medicare Advantage OEP is your chance to make changes to your Medicare Advantage coverage. It lasts from January 1st to March 31st each year. During this time, you can switch from one Medicare Advantage plan to another. You may also disenroll from Medicare Advantage and go back to original Medicare. If you return to original Medicare, you can choose a standalone Part D plan during this period. Any changes you make will take effect on the first day of the following month. Now, special enrollment period for Part D. During certain life events, you may be able to enroll in a new Medicare Part D plan, guys. Now, this period after a qualifying life event is called a special enrollment period, SEP. There are several conditions that may trigger on SEP known as qualifying life events, QLES. For more information, check out this list of QLES. So in blue it's mentioned, you can click on and get the information there. Now, Medicare Part D enrollment, common mistakes to avoid. One major pitfall you will want to avoid with your Medicare prescription drug coverage is the late enrollment penalty. This penalty is an amount that is permanently added to your Medicare drug plan's premium. You may have to pay this penalty if there is a period of 63 days or more after your Medicare IEP, where you don't have creditable prescription drug coverage. Creditable drug coverage refers to a drug plan that pays at least as much as Medicare Part D on average. There are few common mistakes that could land you with a late enrollment penalty. Not enrolling in Medicare as soon as you can. Try to enroll in a Medicare or Medicare Advantage drug plan as soon as you qualify for Medicare. That way you can avoid a late enrollment penalty later, even if you don't need prescription drug right now. Not getting Medicare drug coverage if you lose other insurance. Once you go 63 days in a row without a Medicare drug plan or creditable drug coverage, you run the risk of getting a late enrollment penalty. Let's scroll. Not keeping track of your records. If you get your prescription drug with the help of creditable drug coverage, keep your plan's record handy. If you don't tell your Medicare plan about this coverage, you may end up having to pay the late enrollment penalty, guys. When you enroll, it is important to compare plans before you make a decision. Medicare Part B plans may offer based on their pharmacy networks, their premiums, or the drugs they cover. Make sure you find a plan that works best for you. Now let's scroll. These are the sources, guys. So this is the contact us, see the plan in your area. You can just type the zip code and you can shop for your plan. You can request a call, as I said before. You can contact the Humana sales agent, licensed sales agent. Okay, they can help you. And this is the contact number. Perfect. Super. So we have discussed this page, how to enroll in Medicare Part D prescription drug plan, right? Let's go back. Give me one moment. We'll click on view more Medicare enrollment resources. Okay, now learn about Medicare eligibility and enrollment. These are more details. Let's scroll. Okay, perfect. So you're ready to enroll in Medicare. Get the who, what, where, when, and how to signing up for Medicare for the first time. Also find out how and when you can switch Medicare plans if you are already enrolled. Now here, get answers. You can get answers here. Now initial coverage election period. Learn about ICEPs, that is initial coverage election period. Medicare Advantage open enrollment period. Explore your options. You can click here and explore your options here. Am I eligible to enroll in Medicare? Check your eligibility. Now let's scroll down. Here, Medicare eligibility. If I am still working, am I eligible for Medicare? Medicare eligibility, age, qualification and requirement. Medicare options if you are disabled or under 65. Medicare eligibility if you are turning 65 and when to apply. At what age should I take Social Security? Early retirement versus working after retirement. How to qualify for both Medicare and Medicaid. Let's click here and see what it is, what details we get. When to sign up for Medicare if you are still working past 65. Many people choose to keep working past 65 and keep their coverage under their employer's group plan. But if you have been paying into Medicare via payroll deduction, you may as well enroll in original Medicare Part A hospital insurance when you are first eligible, as you will pay no premiums, guys. For Medicare Part B medical insurance, most people need to enroll when they turn 65 to avoid a late enrollment penalty. Only people who have health insurance from their or their spouse, current employer, may be able to delay enrolling in Part B and delay having to pay the monthly Part B premium. In 2024, that premium is $174.70 or higher depending on your income, guys. Medicare special enrollment period. If you are 65 or older, your medical insurance coverage is under a group health plan based on your or your spouse current employer. You may qualify for a special election period, which is called as SEP. This process will let you sign up for Part A and or Part B during the 8 months period that begins with the month after your group health plan coverage or the employment is based on, and whichever comes first. The bottom line is explore your option, talk with your company's benefits administrator, find how your current health plan works with Medicare. Guys, this is what we learned. Now let's go back on this resource option. Okay, let's scroll. So we are trying to explore everything on our website, the official website of Humana Insurance Organization, so that we don't miss out on anything. So in every series we cover a particular part, and then in next series we cover another part, so on so forth. There will be a back-to-back video tutorial parts which will be coming on Humana Insurance, guys. Now let's scroll down. Okay, so this is medical enrollment, Medicare eligibility. All right, let's see one or two more options, and then the same way you can click on the website, go through it, and you can do your study the way I'm doing it right now for you. Now at what age should I take Social Security? I have clicked on that option. Let's go through it. What age should I take Social Security? Now, Social Security is the main source of income for most seniors. According to the Social Security Administration, SSA, even if you have other retirement accounts, it is natural to look forward to receiving the Social Security benefits you have worked so hard for. How soon can I take Social Security? When it comes to receiving the maximum Social Security benefit possible, timing is important. Sometimes beneficiaries may receive more by delaying withdrawal, but some older adults may need the funds sooner. Okay. Start by asking yourself some questions. Do I want to retire early? Do I want to need to work past age 70? What happens to my Medicare if I work past age 65? Right, so these are the questions which you should ask yourself. The SSA website offers future planning calculators to help you estimate things that can affect retirement. These includes life expectancy, pension eligibility, spousal benefit, and retirement age. While you can take benefits as early as age 62, it may not be recommended. Only those on disability or surviving spouse can take Social Security early than 62. Now, your full retirement age, also known as normal retirement age, determines if you can receive full benefits. While the original full retirement age was 65 for all, here is a snapshot of how the law has changed. Now here is the chart, guys. Year of birth, normal retirement age. So here you can see the years, here you can see the age. Okay. If you take Social Security up to 36 months before your full retirement age, your benefit will be permanently reduced on a monthly basis by 5/9 of 1%. If you withdraw more than 36 months early, your benefit is reduced by 5/12 of 1% each month. Why should I wait? You can take your Social Security benefit early, or when you reach retirement age. You can also delay benefits. Whether you are still working to have budgeted enough to live without Social Security benefit, you may be on the plus side when it comes to your monthly payout. Now, if your full retirement age is 66 or older, check out this chart. So in blue it's mentioned, you can click and you can check the chart to see how delaying retirement even just by several months could affect your Social Security benefit to your advantage. You can also use this retirement benefit planner to determine the best time to access your Social Security benefit, guys. Will taking Social Security at any time affect my Medicare? Though they are separate programs, there are some beneficial connection between them. If you are receiving Social Security benefits, Social Security works with Medicare and you will get an initial enrollment package from Medicare 3 months before the month of your 65th birthday. Now, also, Medicare premiums will most likely be collected by Social Security. If you are already receiving those benefits, Social Security will send a notice before the deduction begins. If you aren't receiving Social Security retirement benefits, you will get a monthly bill from Medicare. Now, plan first withdrawal rater. Healthcare coverage can be a major retirement expense, and Medicare is not all inclusive. Before you choose to take Social Security, make sure you have reviewed your budget, being careful to factor in healthcare costs, inflation, and unexpected events. Don't underestimate those expenses. A fixed income may not allow for much fluctuation. Also, people are living longer, so retirement may be longer than you planned for. According to the SSA, more than 1 in 3 of today's 65 years old will live to age 90. More than 1 in 7 will live to age 95. The decision of when to take Social Security is important and personal. It will likely factor into how you meet your current and future healthcare needs. And before you make your next move, and be better prepared for what lies ahead. For added peace of mind, consult a financial advisor before making any major decisions about your Social Security and retirement date, guys. So this is what we have learned on this page. This is the extra piece of information which I have given you. Let's go to one more piece of information, and then the same way, if you need details, you can view on more Medicare option. You can click there and you can scroll down and you can find your options here. So we have discussed at what age should I take Social Security. Now, early retirement versus working after retirement. Let's click on this option. Let's see what it is. Early retirement versus working after retirement. Is there such a thing as an official retirement age? For those who work 40 hours a week, 52 weeks each year, retirement represents 280 hours of time per year to play with and plan for. A little homework can help guide you as you contemplate your retirement timeline. Now, Medicare, unless you are eligible due to a disability, you are not eligible for Medicare until you turn 65, regardless of when you stop working. Now, Social Security. If you retire early and claim Social Security benefits before your full retirement age, your Social Security check may be reduced by as much as 30%. Now, retiring aging into Medicare. Any signing up for Social Security are major life events, each playing an important role in our long-term financial security. But the best way to make the most of each to take some time to consider them together. For most of us, Social Security and Medicare eligibility are determined by age. Maybe you have had a difficult year health wise. Maybe your workplace has changed so much and it no longer feels like a good fit, or your adult children need support with childcare for the grandkids. If you want to retire early, take some time to consider your option for Medicare coverage while you wait for Medicare to kick in. Let's look at the issues. Retirement age. Should you retire at 60, at 55, at 62? Only you can answer that question, but whatever you decide, you will want to understand the impact of reduced benefit and income on healthcare planning and budgeting. Medicare, unless you are eligible due to a disability, you are not eligible for Medicare until you turn 65, regardless of when you stop working. Social Security. Workers who retire early with receive reduced Social Security benefit as much as 30% less. Post-employment healthcare planning. Are you sure you won't lose employer-sponsored insurance by retiring early? Find out before you make your next move if you will no longer be covered. Find out what health insurance for retirees under 65 will cost you and whether your budget can maintain the expense until Medicare kicks in, right? So, do you want or need to quit work past 65? Do you love your job? Do you enjoy the structure of your work life, the camaraderie of working as part of a team? Maybe you had just like a few more years to beef up your retirement fund before you say goodbye to a steady paycheck. You can work as long as you are healthy and inspired, age aside. However, your age does affect timing for Medicare and Social Security. Here is what you should know about working past the retirement age. Potential pros: a bigger pension and or 401k, a larger nest egg, higher social security benefits, coordinating your schedule with your spouse if he or she is still working. Potential cons: Potential cons: choosing to work past 65 may affect your Social Security and Medicare option at age 70 and half. Required minimum distribution from your individual retirement account apply. Withdrawal will factor into your taxable income. Consider the age factor. It is important to sign up for Medicare when you are eligible to avoid late enrollment penalties. However, there are situations when you may qualify for a special election period, including losing coverage of an employer group health plan. Social Security. You can start your retirement benefit at any point from age 62 up until age 70, but your benefit will be higher the longer you delay starting it. Your benefit won't increase after age 70 you can determine your full retirement age between 65 and 67 depending on your year of birth and calculate your benefit with the Social Security Retirement Age Calculator. Now, healthcare planning impact, you can claim Social Security benefit as long as you have reached your full retirement age, even if you are still working. Likewise, you can choose to enroll a Medicare once you turn 65, even if you're still covered by your employer's healthcare plan. How do I make the best choice for my budget? For some people, retirement is a goal they have worked towards for years. For others, work is fulfilling and they see no reason to stop. You would likely never been retired before, so it is impossible to know whether you will fully enjoy early retirement over extended work, or even if you will dislike working longer as much as you think you will. Ultimately, the choice is yours. See a Medicare option in your area, guys. So now I have discussed this page as well. So we had a complete discussion today in the studio in this video tutorial about Medicare enrollment and understanding Medicare enrollment period, Medicare open enrollment guide, how do I switch Medicare plans, how do I enroll in a Medicare Part D plan, and we have also discussed on this view more Medicare enrollment resources. Now, if I just have discussed 2 or 3 from this view more Medicare enrollment resources. If you wish, you can just go on this official website of Humana Insurance Organization and you can go through in detail about all the options available there, guys.
That wraps part 3 of our Humana Insurance tutorial series. I hope that you found this video useful. If you enjoyed watching this video, then do give it a thumbs up and consider subscribing my channel for more insightful tutorials and tips. And don't forget to hit that notification bell so that you don't miss an update. If you have any questions or need further clarification, then comment below. And be sure to check parts 1 and 2 if you haven't already. Thanks for watching. I will see you in my next video. Bye bye.